Oh yeah, it's on X. Yep. Okay.
Okay, let me pick it up here real quick.
8 viewers already. Nice. This broadcast not available. Does it show that for you? Not available. Does it show that for you?
No, it's coming up. I can hear your
I
voice
see
on
it.
it.
I
Yeah.
see it.
I think we're good, Nick. Okay,
Right.
let's beam us in, and we're going.
All right. Welcome to McCullough Foundation's first ever live stream. Today we have the president of the McCullough Foundation, Dr. Peter McCullough, and he's going to tell us a bit about the most critical updates regarding spike detoxification. So, Dr. McCullough, what have you found out recently regarding clearing out these dangerous spike proteins from the human body?
Nick, I tell you, it's terrific to be on this live stream broadcast with you from the McCullough Foundation. McCullough Foundation is the leading not-for-profit organization bringing medical truth, justice, and importantly, influencing public policy in the United States and all over the world. And as an internist, cardiologist, and epidemiologist, I have been examining patients and handling these pandemic issues that have arisen. And most of them are due to the spike protein. So virtually everybody knows what a spike protein is, but if we examine the pathogen, this is what all of us have had. Everyone recognizes this now. It does make this arc around it, but the spicules on the surface of the sphere is called the nucleocapsid. The spicules are called the spike protein. And so with the infection, the outer tip of the spike protein is installed in the human body. And Bruce Patterson at IncellDX has shown that it can stay within the human body for about a year and a half or longer. And with the emergency countermeasures that 94% of people who took them did take the genetic form of them, it installs the genetic code for the spike protein. So the full-length spike protein with a proline insert, and the two manufacturers that make the most commonly used products actually use the same proline insert. And sadly now, a study by Brochna shows, at least in half of those who took them, the full-length peptide is in the human body. And now a paper from Yale doing the SPEAR assay has found, again, the spike protein in blood now about 9 months afterwards. The spike protein gathers in threes and it twists. It's called trimerizing. And the spike protein has been found in the heart, the lining of the brain, all the vital organs in the body. And it's clear that the spike protein is causing inflammation, it's causing oxidative stress, causing damage to tissues. It's the cause of these long pandemic syndromes, Nick. There's no doubt about it. Sadly, many papers report on cytokines or inflammatory factors, but they actually don't measure the spike protein. In fact, we don't have a commercial assay for the spike protein right now. There's just a few research assays, one by Brochna, which is mass spec, and the other one by Yale, which is the SPEAR assay. But importantly, what we can do in clinical practice is we can measure antibodies against the spike protein. So let's examine this slide here. There is the spike protein. Just go back, Nick, for a second, just so we can show the spike protein. It can be free as peptide fragments as shown, but it can be organized into exosomes, which are small phospholipid packets. Now, the packets themselves are not infectious particles, but they are exhaled, for instance, in breath. They're in saliva, various body fluids like sweat and breast milk for sure. So many have been concerned about spike protein shedding. And I do believe, as a researcher, a scientist, and clinician, this shedding is real. I think it's relatively minor clinically, but it does represent spike protein from one person impacting another. And the best example is in women who are menstruating around other women who are harboring the spike protein, in fact, having their menstrual periods altered. That's been shown in study after study after study. About 70% of women will actually manifest that phenomenon. And so we do think that's a form fruste, if you will, of shedding. Now, Nick, if you can show us this test, this important test, this is probably one of the most important take-home points. So many people contact me all over the world and they say, Dr. McCullough, you know what? I had the infection or I took them. I had to take them. Now I'm worried. Do I have a significant amount of spike protein in my body? And my recommendation is to get this test. Now, it's offered by LabCorp in the United States. The assay manufacturer is Roche. Now, they are a worldwide global manufacturer headquartered in Europe. And it is the quantitative antibodies against the spike protein. So it's not the spike protein itself, but is the antibodies that are raised up against them. And here, no exposure to the spike protein, the value would be less than 0.8. Low risk, a low exposure wouldn't generate much in the way of antibodies, would be 0 to 1,000. And progressively higher risk would be over 1,000. So I routinely see patients now at 5,000, 10, 15, 20,000, invariably with problems where the spike protein is known to cause myocarditis, blood clots, cause heart palpitations, raise blood pressure, cause stroke or Guillain-Barré syndrome or small fiber neuropathy, invoke autoimmune problems like rheumatoid arthritis, and spike protein could theoretically be related to the risk of cancer. So, all of that is contained in this test. It is a test that's widely available. It's probably one of the most widely ordered tests that LabCorp does right now. Everybody listening to this who's concerned should get an antibody test against the spike protein and know your number. If you're less than 1,000, I think there's relatively little to worry about. And if you're greater than 1,000 and progressively higher, there is a worse prognosis. So Nick, let me ask you, have you had this test done yourself?
I have not. And I'd very much like to see if I have been shed on or even if I was infected multiple times, which I was. So I would be very curious as to how much I have. What about
Yeah.
you? Have you tested yourself?
Yeah, I have, Nick. I didn't take any of the emergency countermeasures, and I feel so blessed that I was able to make that wise decision. About 20% of Americans didn't take them at all, and I don't know a single person who regrets declining them. But I did have the infection 3 times, the pandemic infection. The third time was actually had the longest duration of symptoms. I think I coughed for at least 3 months afterwards. I couldn't go to work. I needed an IV. My wife and I were both acutely ill. So about 3 months after that third episode, and that third episode for me could have been the JN1 variant, I had my test done, this particular test, and I was 2,300. And my manifestations of a pandemic syndrome were ringing in the ears. I didn't feel so energetic. I didn't feel like I could run like I used to. Just a lack of, just an overall malaise. There's only one time I can recall this lack of mental clarity, otherwise known as brain fog. But I did set out to do something about it. And Nick, that brings up, your critical paper published in the Curious Journal of Biomedical Sciences. So why don't you explain this paper to our audience?
Yeah, so this paper we actually published it in the end of 2023. And what we did was we actually laid out all of the harms that spike protein has on the human body. And there's now over 300 peer-reviewed papers indexed in the National Library of Medicine that show the harms of this protein. And it does damage every single organ system, and it's very persistent in the body. Unfortunately, it seems we lack an innate clearing mechanism to get it out. And that's evidenced by a recent paper out of Yale that found the spike in somebody who received them actually over 2 years after receiving it. And so we know that it stays in the body. And so we looked, well, what compounds? What could we do to help the body clear it out? So let's take a look at this central figure here that was published in our study. So if we look at panel A, dissolution of spike protein induced thrombus. So it seems that the spike has been found actually directly within blood clots, and it's not being degraded by the classical pathways. It's the fibrin is resistant, and so we need to add in some support. And so we found actually a paper that showed nattokinase directly dissolves and degrades the spike protein in a test tube. So we know it can do that, and we know the pharmacokinetics of nattokinase. It does get in the bloodstream. And so, if you look at that figure there, that can help bust open these spike-induced clots and deal with the spike at the same time. And we go over to panel B. We have bromelain and curcumin. So those two have been shown to inhibit the ACE2 receptor, preventing other things from binding. But what binds to the ACE2 receptor is the spike protein from both the virus and the product. And so doing that can prevent it from docking in the first place. And then, like I mentioned earlier, nattokinase, but as well as bromelain have shown to be able to degrade the spike protein. And so that's that. And then curcumin can help suppress any hyperinflammatory responses produced by your body. Curcumin is a potent anti-inflammatory. You can see the mechanism there in panel D. And this is pertinent because we do see such high levels of these cytokines in the injured. And so panel E, Dr. McCullough, I'll have you talk about panel E, the treatment protocol itself.
Right. We think this key figure, and it was copyrighted in my name mainly so people can locate it historically or in social media, even in the National Library of Medicine. McCullough protocol base spike protein detoxification. Nick, because we believe it's a base. Now we add other things to this triple combination of nattokinase, bromelain, and curcumin, but we're fortunate that the data continue to accumulate supporting the notion that the spike protein can be proteolytically degraded and then cleared through the reticular activating system. That these doses that we chose in panel E were low and conservative, and now we've progressively increased these. Probably the biggest update I have for this broadcast is nattokinase. Now clinically, we are ranging to 8,000 units twice a day. So that means 16,000 for a total dose. Bromelain ranging to 500 twice a day, so 1,000 milligrams, and curcumin easily ranging up to 2,000 milligrams a day, Nick. And that's the dose that an average Asian Indian takes in their diet. Remember, curcumin is not only anti-inflammatory for the spike protein, but is also anti-arthritic. And we've published on our Focal Points Substack that curcumin could actually have anti-neoplastic or anti-cancer properties. So we have this triple combination as a base. And so we have some common scenarios, and shown in panel E, if there are any chest symptoms. So for instance, pleurodynia, palpitations, chest pain. We're concerned about subclinical myopericarditis or pleuritis. And there we know the spike protein is in the chest. We know it does incite inflammation. Our go-to drug there is colchicine. Colchicine is the inhibitor of microtubule assembly. It's been FDA cleared for the use of gout. It's standard of care in pericarditis in clinical trials and the guidelines. And very importantly, it is generic. It's affordable. Its safety profile is well known. It's derived from the petals of a purple flower. So I'm talking about colchicine in the lower right corner. The standard dose for gout is 0.6 milligrams twice a day. And at that dose, there can be some GI toxicity in muscle aches. But for this application, the dose is 0.6 milligrams a day. And there, the toxicity is much less. Under my direct observation, it's rare that a patient can't take this But colchicine, very important. Now, that will be a prescription in most countries watching this, including the United States. But once somebody is on base spike protein detoxification and colchicine, I have clinically, with thousands of patients under my care, never had a patient suffer a cardiac arrest or a significant arrhythmia. In fact, just the opposite. Arrhythmias and the clinical and subclinical myopericarditis slowly resolve. Now, the other drug mentioned in panel E is hydroxychloroquine. Hydroxychloroquine is FDA cleared to treat systemic lupus, rheumatoid arthritis, and for malaria prevention. It was widely used through the pandemic. And there, the key trigger for the use of hydroxychloroquine in these long pandemic syndromes is the blood ANA, or blood anti-nuclear antibody test, turning positive. If that test is positive, I think there's an opportunity to, in a sense, shut off autoimmunity. The autoimmunity probably triggered by spike protein, but in a paper by Boros and colleagues, and I'm a co-author, we estimate there's about 12 different frame-shifted unwanted proteins that are produced from the synthetic genetic code. And there they can incite autoimmunity. So as we clear spike protein and hopefully clear frame-shifted peptides, there's an opportunity to shut off autoimmunity, and that's with hydroxychloroquine. So
this should clear out these frame-shifted proteins as well, right? There's no reason. If it degrades spike, why wouldn't it degrade the others?
Well, that's a good point. Now, hopefully spike has and the frame-shifted have enough homology, Nick, and presumably they're shorter. Maybe they're already handled well by our existing proteolytic systems that work with the reticular activating system. But the autoimmunity, this idea that antibodies now are directed against the human nucleus, is unsettling. And I just don't like to leave somebody ANA positive who's been through the pandemic right now. Hydroxychloroquine, I think, plays a role. Hydroxychloroquine for 3, 6, 9 months, maybe 12, colchicine for a total of 12 months. Now, people have asked about what about the other things that one can do? And, I would, this paper we published now over a year ago, based on my clinical practice experience, I would say for loss of mental clarity, using a nicotine patch, 7 milligrams a day, plays a salutary role. Again, that can be for about 90 days. Nicotine antagonizes the spike protein's interaction with the acetylcholine receptor. I would say that if there are craniofacial features, trigeminal neuralgias, headaches, loss of taste and smell, persistent pulmonary symptoms, cough, ground glass appearance on imaging, or skin rashes, that they actually may indicate persistent replication of the organism, actually that the organism is still there and alive, to be pointed. And it's been my experience that ivermectin plays a role. Now, it's dispensed in 12 milligram increments. So someone your size, Nick, would probably take 48 milligrams a day. That would be a standard ivermectin dose. And I would prescribe that for about 90 days. And the goal is to use colchicine, hydroxy, ivermectin, nicotine to help resolve the syndromes and manage the symptoms, but they're not getting rid of spike protein. It's not ivermectin alone. It's the nattokinase, bromelain, and curcumin that together are getting rid of spike protein, and everything else we use is adjunctive. Now, I have a paper in press by Dr. Jess Armine, where additionally augmented N-acetylcysteine is used as an antioxidant, and that appears to have a salutary role. And then, as shown on the screen, this breakthrough paper by Dr. Shirasawa in Japan regarding the use of a broad list of enzymes. So it's not just nattokinase and bromelain, but also lumbricase, papain, a whole variety of enzymes, over a dozen or so in combination 3 times a day. As Dr. Shirasawa was able to show here, a man who came in with loss of mental clarity and had taken 4 of the emergency countermeasures, which is, we don't see that much in the United States, but Japan are very compliant. They do so. He had sessile thrombi, as shown in the bilateral internal carotid bulbs. I mean, this is stunning, Nick. He actually had blood clots in the arteries going to his brain. And Shirasawa showed with this intensive enzymatic approach, and Shirasawa is convinced spike protein was in the blood clots. That's the reason why this works, that the blood clots dissolved with this nattokinase-based enzymatic approach plus aspirin, which is an antiplatelet drug. But Nick, I can tell you so many people have commented on the Shirasawa paper, as they should, because it's a first-in-man observation clearly showing, an impending problem, a near fatal stroke on the way for this man who's basically my age, to clearance of the entire problem by virtual angioscopy. What was your reaction to this paper?
Yeah, I mean, that's huge. It's literally the first in man, like you said, of proteolytic enzymes actually clearing out the problem. I mean, it's absolutely huge. And this goes to show, because the federal government and everybody wasn't funding such studies, wasn't funding long-term double-blind placebo-controlled trials, we have to do it ourselves. And so this is what we're doing. And so we would call for, intensive investigations into how to clear out these proteins and all this damage. It's absolutely pertinent. But yeah, this paper was absolutely key. And we also have another paper that we published.
Mhm.
This is the McCullough Foundation paper, where again we used base spike detoxification, and this person had myopericarditis. So why don't you tell us? You think it played a role in the resolution of this heart inflammation?
Yeah, this is another first-in-man report. Credit middle author Alexander Vickery for his contributions at Iowa State University, but a young man who has clinical myopericarditis after taking one of the regretted countermeasures. It will not go away with courses of prednisone, colchicine. He was on intensive detoxification. He researched it. And we used rapamycin, which is an inhibitor of the cell cycle. It's also used as an anti-rejection drugs in organ transplants, but we use it at a very low level, just 1 milligram a day, which is actually the dose used for research on longevity. It's very safe. I checked multiple CBCs at about 4-week intervals to make sure he didn't have any white count depression or abnormalities, and he didn't. But what we demonstrated was a resolution of his EKG changes, his symptoms resolved. He actually had transient heart failure. That was documented and then resolved with rapamycin in addition to base spike detoxification. But Nick, in his case, his antibodies against the spike protein started out over 12,000. And then after intensive detoxification, they dropped below 3,000. So it was a gratifying case. The product he used, Nick, why don't you bring it up on the board, was McCullough protocol base spike protein detoxification as the ingredients in the ultimate spike detox offered by the wellness company. So this is, people have been asking, Dr. McCullough, I just can't buy all these different supplements. Is there something I can take that's an all-in-one product at a high dose? We're talking medicinal doses of these enzymes. These are very high quality grade, non-GMO, no trace contaminants in this. This is the best you can get. It's the wellness company, Ultimate Spike Detoxification. It's one of the most widely used products, actually, of all the products in the pandemic era. So it's 2 capsules twice a day. It's going to deliver 8,000 units of nattokinase. Also, it delivers high doses of bromelain and curcumin. But there are some minor ingredients, and I remember having to justify this with the Federal Trade Commission. And as full disclosure, I'm the chief scientific officer of the company. We had to justify dandelion root extract, black sativa, selenium, which aids in absorption. And then anytime we use the curcumin, we add some bioperine in it. Bioperine helps markedly aid in the absorption of the curcumin, and we need that. We want to make sure these get absorbed. Now, Dr. Tanakawa in Japan has tested nattokinase through using pharmacokinetic studies, and clearly nattokinase gets in the bloodstream. So I want people to know these are not wasted supplements. They clearly get in the bloodstream, and they have a medicinal effect. Now, one of the most common questions I get is, how long should one be on this? And the current recommendations are for a year and then reassess. We like to recheck the antibodies at 9 months to a year. If we see a 20% drop in the antibodies against the spike protein, we know we've made big progress. Probably the massive spike is considerably reduced. And then we reassess. And I always tell patients, particularly high-risk patients, if this is well tolerated, until we learn more about spike, Nick, we probably should continue this indefinitely, because we don't know about recurrent infection. We don't know about continued production of spike protein from the genetic code, or we don't know, quite honestly, whether or not there is reverse transcription and integration into the human genome, and maybe somatic cells producing spike protein on their own. We simply don't know. Play it safe. Nattokinase itself is anti-atherosclerotic. It's taken as a heart supplement for decades by the Japanese. Bromelain is also cardiovascular beneficial in terms of being an antithrombotic. These are slight blood thinners. Curcumin, again, anti-arthritic and anti-neoplastic. So why not take these together? The main caveat, Nick, is bleeding, and that is easy bruising, bleeding when you brush your teeth or blow your nose. If you see that, that means the dose is too high. Make sure you always consult with your doctors. Now, under my direct supervision, I use this in addition to traditional blood thinners like the novel anticoagulants, apixaban, rivaroxaban, and dabigatran. I also use it in addition to warfarin. But if you're listening to this and you're thinking about taking this, make sure you check it out with your doctor if you are on serious anticoagulants. It also can be used with aspirin, as Dr. Shirasawa showed, as well as clopidogrel, which is a thiopyridine we commonly use in stenting. So, Nick, before we get to questions, I just want to ask you one about what you're doing. What are you doing to prevent getting another infection?
Yeah, so to prevent getting another infection, not only have I been taking this spike detoxification to prevent this spike protein from docking to my cells, has been shown that. And actually, one more thing about curcumin also in this protocol is that's antiviral in and of itself. It shows potent antiviral activity against a broad range of viruses, and so that's definitely important there. But on top of this, we recently uncovered, and multiple studies have now come out, is that vitamin D levels are absolutely critical on top of this in preventing infection and improving the immune system. Actually, recently, one of the recent studies that came out showed that in those who took the products, who had chronic fatigue syndrome, when they improved their levels, all of them were below what they should be. They improved their levels, and then improved this fatigue, this immense fatigue. They couldn't do anything in basically all the patients. And also for myocarditis, it also has shown improvement in symptoms for that, reduced hospitalizations, and reduced risk of death with that. So it's very important for vitamin D. And then other nutraceuticals, right? I take vitamin C. That's vital for your immune system as well. That helps clear out all the pro-oxidants, helps with the oxidative stress. And so that's what I do. And honestly, I have not been sick. I've not been sick in 2 years. In 2 years, I used to get sick all the time. So, but one more thing that I'm also doing is I am using nasal sprays. I am using
Wow.
nasal sprays.
Mhm.
They've shown efficacy in multiple studies against viral replication in the nasal pharynx. So, Dr. McCullough, why don't you tell us a bit about the importance of nasal sprays?
Yeah, most of my fans will recognize a few years ago, I was sick all the time going on national TV, and I'm finally catching up with Nick and becoming healthy again. I'm coming up my first year with no illnesses. I'm doing the supplements that Nick advised, and particularly vitamin D. I'm targeting 10,000 units a day, plus 100 micrograms of vitamin K. Also, I'm high on B vitamins and vitamin C, and some anti-infection, immune boosting supplements like echinacea, elderberry, oregano, These are very important. Those of you in the natural health space, you'll recognize this. But in addition, I'm using nasal sprays and gargles. We're featuring Clear, which is xylitol-based product, 2 to 4 squirts up the nose, sniff it back, spit it out, spray it in at about a 15-degree angle, twice a day, religiously, Nick. And then gargling, the ones I like are Spry, which is the gargle, xylitol-based gargle. It's also a dental rinse. Multiple studies support doing this. It also strengthens the teeth, reduces dental caries, improves the oral pharyngeal microbiome. We think this package coming out of the pandemic that people can do with supplements, having some savvy with respect to guiding their doctors on some prescription medications if they're needed, and then oral nasal hygiene. We think this is the way out of the pandemic, Nick, and myself, people in our family circles. We're a lot healthier than we used to be. And, the pandemic's wearing 5 years on humanity right now. And I'm grateful that we've been able to find some things clinically to help people. So, Nick, why don't we go ahead and open this up for questions? I see some of them piling up in the inbox. Why don't you go ahead and read off the first question?
Yeah. So, first, I want to say, everybody who's watching right now, please submit your questions right now in the comments section. We'll get them. We'll answer those questions. So please send them right now. But the first question we got so far is, are there any side effects to taking these supplements? Like, what's the safety profile? Is it going to cause any serious adverse events? What have you found on that?
Well, Nick, let's put up the base spike detoxification from the wellness company. Now, I'm the chief scientific officer. This is the most widely used product in the space. So go to twc.health/courage, twc.health/courage, and check it out. Ultimate Spike Detox. The important points are the nattokinase and bromelain must be taken on an empty stomach. So that means the entire capsule should be on an empty stomach. So make sure it's been 3 hours after you ate, or at least 30 minutes before you're going to eat. So a lot of people, it's late at night, early in the morning, stomach's empty. Take your Spike Detox. Now, if you take all 4 capsules together, there can be a little bit of not GI upset, but just not feeling good just because of the too much gelatin. So I think if you just take 2 twice a day between meals, and then work your up to 4 twice a day between meals, that would be kind of max dose. The Myopericarditis can cause some GI upset because it's black pepper extract. And then beyond that, the main risk is bleeding or bruising. So you're either going to have it or you don't. And make sure you pay attention to how easily you bruise, if there's any nose bleeding or bleeding with your gums when you floss or brush your teeth. And if that happens, you simply can stop it for a few days and adjust the dose down. Each person's different, Nick. Taking it in addition to aspirin increases the bleeding risk. The same thing with clopidogrel or anticoagulants. I personally take it with aspirin. And I know my blood is probably a little thinner medicinally than what it would be at normal. But Nick, I'd rather have that than the risk for blood clots. And boy, have we seen blood clots. Okay,
Right.
What's the next question, Nick?
So the next comment says, 4 years post-product administration, my spike antibodies are still over 6,000. And that's all he said. So what would you have to say to him? How could he get those antibodies down?
Well, the question really is the interpretive framework of the antibodies. Now, remember, the antibodies indicate the response of the immune system. So it could just be a good sustained immune response. But 4 years, antibodies should, after the natural infection, should tail off after 6 months. So for 4 years, the great concern is that there's been quite a load of genetic material in the body. There may have been reverse transcription. We could improve it. Or one of the most common scenarios I see this, Nick, is recurrent exposure. Maybe this person is, working a job where they're exposed to people over and over again. Let's say a flight attendant or a medical assistant, someone who's forward-facing and gets a lot of exposure. Now, over 6,000 is manageable for this individual. I hope they have considered Ultimate Spike Detox from the wellness company. 2 capsules twice a day between meals. If well tolerated, could be advanced to 4 capsules twice a day between meals. And it's been my experience that it won't stay over 6,000 after that. It'll start to move its way down. You look for a 20% drop, Nick, so that would be wonderful to see it below 4,000 if remeasured in about 9 to 12 months. What else you got for us?
And so our next question is, can you use a nicotine patch if you use an estradiol patch?
There should be no problems there. Remember, estradiol patch used for postmenopausal symptoms. Now, the nicotine patch, the caveat here, Nick, is go low dose if the person's a non-smoker. Remember, most people nowadays are non-smokers. So when nicotine patches came out, we were using 21 milligrams a day for smokers because they, were nicotine addicted. For non-smokers now, 7 milligrams. This is available over the counter on Amazon. You get a Habitrol patch for 7 milligrams or a doctor's prescription. And if there's any nausea with this or people feel sick, it's too much. And so they may want to cut the patch in half or just convert over to nicotine gum, which is 2 milligrams. But, people with severe loss of mental clarity or brain fog, they have reported that they really do perk up when they give a trial of nicotine. Now, it's not forever. Typically go about 3 months, and that's usually enough to get spike detoxification and get people feeling a lot better. But I give credit to Dr. Brian Artis. He's a doctor here in Dallas-Fort Worth who made the initial observation on nicotine and its salutary effect because it blocks the spike protein interaction with the nicotinic acetylcholine receptors. What else you got?
Okay. And actually, I have a question regarding nicotine. So I know a lot of people my age, especially, it's all over X, all over social media, is Zyn pouches. So these snus pouches that are basically these pillows. Would you recommend against those? Are there risks to like what form of administration would you find the safest? Would it be the patch, and then gum, and then would you say the things that stay in contact with your gums are risky? What would you say to that?
Well, the key is, where this came from, Nick, is the observation is smokers did incredibly well through the pandemic with a lower risk of severe pandemic respiratory illness and lower risk of side effects from the countermeasures. So, this was an amazing observation. And remember, smokers are always going outside to smoke every few hours. So they keep nicotine levels constant through the day. And so it's the constant levels of nicotine that seems to be protective. And so there, the best way to get constant levels is the patch, the transcutaneous nicotine patch. The gum gives nicotine levels, but it goes up and down. You chew gum, it doesn't last forever. And then, of course, these pouches or just even traditional, what's called dip snuff, they provide a tonic level of nicotine, typically pretty high. The concern with direct contact, particularly if it's tobacco direct contact, that would be like a Skoal or dip snuff, is there are carcinogens in the tobacco. Now, my understanding is, Nick, with the pouches, they actually don't have any tobacco itself. Is that true? Is that true?
Yeah, they don't have any tobacco themselves, but I did find a few recent studies that said there's all sorts of contaminants in these pouches. They found nickel, formaldehyde, and some low levels of these metals. So I guess that would be the primary concern with some of those pouches.
Okay. Well, I think everyone should, do their own research on the pouches that, clear medicinally the patch would have the characteristic safety profile that we'd be looking for. But, nicotine itself, is not harmful to the human body. It is addictive like caffeine. It's a methylxanthine, but it's not harmful. So the harmful part of smoking is the tobacco. What else you got, Nick?
Yeah, so any homeopathic remedies that could be useful?
Yeah, there certainly are homeopathic remedies that can be useful. So people have had a GI disturbance. And so GI cleanses, particularly those featuring spirulina, have some evidence base to it for sure. Some individuals have felt that various forms of sauna therapy, certainly the hot, wet saunas with sweating, theoretically spike and genetic material come out through sweat and breast milk. That would be salutary. Red light sauna, I don't know, but that is certainly a possibility. I did travel to the Bahamas, Nick, for a demonstration from a doctor there about methylene blue. So methylene blue, in this case, an intraoral application, and then red light applied, which was virucidal. Some actually ingest methylene blue. I haven't reviewed that. Others have suggested, a whole list of homeopathic remedies. I would point them to two kind of listing sources. One is the former Frontline Critical Care Network, FLCC. They provide a long list, as well as the World Council for Health. And so you can take a look at these other homeopathic remedies. But we do think, based on our clinical experience and our peer-reviewed publications, the core should be nattokinase, bromelain, and curcumin. Without them, I have not seen spike go down, to be honest with you. I know some people have just said, well, I'm just going to take ivermectin forever. I said, listen, it's just not going to cut it, because ivermectin does not dissolve and degrade or dispose of the spike protein. It does strategically block it partially and blocks nuclear entry of the virion, but it will not get rid of spike per se. What else you got, Nick?
That comes to the end of our questions today. So does anybody else have any questions before we wrap this up? Please send it in the chat now and we'll address it. But in the meantime, I have one question. So with everybody taking these products now, actually a majority of the population took these products. What do you think? What are you looking forward to in the future regarding research? Like what should the federal government now that we're making America healthy again? What should they be focusing on that is a very unmet need?
Well, it's a great question. This new moniker, MAHA, Make America Healthy Again. It's really engaged America, I think, on an issue that even if you're on the right or left, you could agree that we'd want to be, healthy. Let me state, for adults, I'm not convinced adults were ever healthier decades ago. In fact, back in the 1970s, Nick, 50% of the population smoked. So we certainly weren't healthier there. The point prevalence of smoking is now 17%. But adults all have things to work on, I think, largely through weight and other, diet and fitness habits. But the children, it's a different story. Children, I think, were healthier 50 years ago, and they're not now. And there, the opportunities in the MAHA movement are to improve the food supply, to reduce various forms of potentially harmful food additives, dyes, various forms of densely hydrogenated oils and fats, so-called trans fats, and removing fluoride from the water, which may have served a purpose decades ago, but has a minimal effect now with modern dental care. I think removing or surveilling aluminum in the water supply should be there. People are interrogating air quality, chemtrails, electromagnetic forces, and so much to work on there, Nick. But let me tell you, I think the single greatest thing that has taken down the health of Americans has been the pandemic. So getting the infection itself and then taking one or more of the emergency countermeasures. And as you said, 80% of the population took it. Right now, in terms of detoxification, our estimates are less than 1% of people are on detoxification right now. So if we had 80% of people take these, we got to get 80% of people going on detoxification. And fortunately, these supplements are affordable. They're widely available. None of them are patented. By the way, we specifically did not patent any of this, so it's all open source. Nattokinase, bromelain, curcumin, the ingredient lists are on Ultimate Spike Detox and Spike Support from the Wellness Company. You can take those ingredients, buy them separately anywhere you want to, at your natural health store or on the internet. But everybody probably, if they've taken the synthetic genetic code for the spike protein, they better start taking some natural products, Nick, in order to start, getting on the pathway to becoming healthier and not to get burned with some problem that develops, including, a cardiovascular event, a blood clot, or some new neurologic or autoimmune problem. Nick, any final questions come in?
Yeah, treating tinnitus, best supplement. So how can we treat this ringing in the ears?
Well, it's a problem I had myself, Nick, and I can tell you, for me, the only thing that did it was about 9 months of McCullough protocol-based spike protein detoxification. I tried everything else. People have tried, homeopathic treatments, Dramamine, other forms of treatment. One of my colleagues has tried intratympanic corticosteroid infusions, oral steroids. I really don't think any of it works, Nick, except for spike detoxification. Just give it some time, and that ear ringing, for me, it's about 80% reduced, and I'm so grateful.
Awesome, awesome. And it looks like we have another question here. Is there a list or website with natural doctors that are knowledgeable on detoxing spike proteins?
Yeah, there's no naturopathic list that I am aware of. I bet some of our listeners may know. If you do, put it in the chat box. But I really refer you to the Association of American Physicians and Surgeons. Association of American Physicians and Surgeons. Go to aapsonline.org and you can download the physician directory, and it has hundreds of listings of doctors across the country. And then, of course, your national resource is the Wellness Company, www.twc.health/courage. You can not only shop for supplements, but you can get a telemedicine appointment. It's very affordable. You can have things reviewed with your doctor, get the spike protein antibody levels ordered, get the appropriate medications and supplement going. So go to Wellness Company, twc.health/courage.
Awesome, awesome. And it looks like our last question here is, somebody said it would be very helpful to have something in writing that describes the blood testing for spike protein. Is there anywhere where people could find this protocol of these antibody tests?
Right, Nick, and maybe while I'm answering this, you can put it in the chat box, but we'll refer our readers to the World Journal of Cardiology in a recent paper that Nick Hulscher and myself have published from the McCullough Foundation. And the title of that is Risk Stratification for Sequelae Through the Pandemic. And you'll see there exactly what protocol we do, exactly the blood test that was ordered and the assay manufacturer, and how to interpret that. So we have a key interpretive figure. That paper is fully peer-reviewed in a high-quality cardiology journal, so it should be available to all your internal medicine and cardiology specialists. And we hope it's helpful because through the pandemic, as a doctor, I've been challenged with what to do. What should I do in this circumstance? There are no guidelines on how to handle these pandemic syndromes. And sadly, the Biden administration invested $1 billion into this. No measurement of spike, no understanding that spike was the underlying cause. And so, as you can imagine, no useful therapies that have come out of that. Nick, we're going to need to bring it to a close. We're coming up on the hour, but thank you so much for joining me on the first ever McCullough Foundation Focal Points live, broadcast, our first live stream. And thanks to each and every one of you for joining and, putting your questions in. It's by asking questions and then listening to learn and answering. That's the way we all improve. And we didn't see this from our public health or government officials through the pandemic. They never held an open question and answer session. And if this is useful to you, give us some more feedback either on McCullough Foundation website or sign up for Focal Points. Get your free email every day and give us some feedback. And we'll put some more of these live streams together that are going to be useful to you. So, Nick, again, thank you so much for joining me. And thank you, everybody, for watching the program.
Thank you.